This study measured the effects of fatigue on EMG amplitude for wrist extensors and flexors. Measuring muscle activity can be done using electromyography or EMG. In this study, we used surface EMG. We use this because it is a non-invasive method for measuring muscle activity, specifically amplitude of the wrist extensors and flexors. The purpose of this study was to see how muscle amplitude changes as the muscle fatigues. It was hypothesized that as the wrist flexors and extensors became fatigued, amplitude would increase as a result of increased motor unit recruitment. In order to achieve this, we recruited 8 total subjects, 5 male and 3 female, with an average age of 24.5 years. These subjects were all first-year DPT students at Regis University. In order to participate, the subjects had to be able to perform pain-free wrist flexion and extension at a maximal and submaximal level for at least 300 seconds, and they had to shave their arm. Once the subjects were selected, we had them sit with their arm resting on a table bent at a 90-degree angle. 6 electrodes were placed in the appropriate spots, 2 running parallel with the wrist extensors, 2 running parallel with the wrist flexors, and 1 on the bicep and 1 on the tricep. To test appropriate placement of the electrodes, we observed the muscle activity under manual resistance. Then the dynamometer was adjusted for hand size, and the participant performed a maximum grip test. We used this to calculate 25% of the maximum voluntary contraction. The subject then held an isometric contraction at that 25% value until max fatigue was achieved. During this, every 15 seconds, the computer recorded the peak EMG value represented as muscle amplitude. So what did we find? As a result, shown in the graph, we can see that the muscle activation presented as a percent standard increased for the wrist extensors shown in yellow and decreased for the wrist flexors shown in gray. These findings only partially supported the hypothesis. The wrist extensor muscles performed as expected. The amplitude increased as the muscles became fatigued, demonstrating that there was an increase in motor unit recruitment in order to compensate for the fatiguing active muscles. However, the wrist flexors had a decrease in amplitude, indicating either a decrease in motor unit recruitment or a potential shift in specific types of motor units recruited. Overall, these results are inconclusive to support the hypothesis stating that muscle amplitude will increase as a muscle fatigues. Clinically, these tests can be used to measure ability to perform activities of daily life. For example, we can measure the time to fatigue, the force production, the muscle activation, and use this to see if a patient has the ability to hold onto various grips for a certain duration in order to prevent falls or injury. These can also be used as tools to measure progress over the course of therapy. Thank you.